quickly and the hotels locked down and quarantined, and the sporting events and public gatherings cancelled. China remains the epicenter of the disease, with nearly 80,000 cases reported. But for the first time, new cases outside the country have exceeded new cases there. South Korea has the second largest number, with over 1,000 infected. The Middle East, Iran still has the most cases, with others in Bahrain, Iraq, Kuwait, and Oman. And now the first reported case in Latin America in Brazil. In Europe, Italy has the greatest number of people infected, with nearly 50% more cases reported in 24 hours. Several other European countries have announced their first infections, including Greece. In Tenerife, 4 cases have meant hundreds of holidaymakers are unable to travel home, whilst here, of the thousands tested, only 13 have caught the virus. Our international editor, Lindsay Hilson, reports on the global spread of coronavirus.
Praying for the sick is a medieval ritual, but this virus is spreading by thoroughly modern means. Those at the Pope's Ash Wednesday audience today are amongst 50 million people who fly in and out of Rome annually from more than 230 places worldwide.
Desidero esprimere nuovamente la mia...
Pope Francis says he feels close to those suffering from the virus and those who care for the sick. His doctors might advise him to limit contact. Older people and those with underlying conditions are most at risk. On the high-speed train from Rome to Milan, everyone is aware that there have been more than 370 cases and 12 deaths in Italy, part of a trend in which, according to the World Health Organization, the number of new cases outside China now exceeds those within. Milan itself is very quiet as the authorities try to balance sensible containment with preventing panic.
Bisogna essere tranquilli.
We should stay calm. There is no reason to be particularly afraid. As a doctor, the only advice I can give is to tell people who are more at risk, the elderly, those with pre-existing conditions, cancer or weak immune systems, to avoid going out.
The island of Tenerife is popular with UK holidaymakers, but the COVID-19 outbreak means hundreds of guests at this hotel have found themselves in lockdown and in limbo.
They've just recommended that we stay in our rooms, and if they see us out for too long, they tell us to go back to them. But that's all we really know. We haven't really been given instructions about what to do.
It's very, very vague, and whenever we try and get more information out of them, they very much just say, well,
keep it locked under the strictest of security.
So now we're going into the main lab, and inside this lab here is where we keep the live virus.
The live viruses?
The live virus,
so
yes.
The most dangerous things that you have at this facility?
Exactly. This is the virus that was isolated from the sick patients, and now it's housed in this lab here.
Australian doctor Danielle Anderson is one of the world's top virologists, with 20 years work in the field and at America's most prestigious universities.
What surprised you about this virus?
The spread of this is really, really surprising. We've seen outbreaks in the past. We think we know what we're doing. And so for me, it's a really, really big surprise.
Why is it spreading so quickly?
So it seems that it's extremely contagious, and it's not airborne, but it is contagious.
Dr. Anderson took